What if millions of Americans suddenly lost access to healthcare and food assistance? Not because of a crisis, but because of a new law. That's the alarming possibility under a sweeping proposal from House Republicans aiming to slash nearly $1 trillion from Medicaid and food stamp programs. Marketed as a cost-cutting effort aligned with former President Trump's agenda, the plan could unravel decades of progress in expanding access to basic support systems. Although GOP leaders claim these cuts target able-bodied adults who should be working, experts warn the fallout could extend much further. Seniors, children, and people with disabilities stand to lose coverage as states grapple with reduced federal funding. Medicaid alone could see $700 billion in cuts over the next decade. As a result, more than 10 million people may lose coverage, and by 2034, an estimated 7.6 million more Americans could be uninsured. One of the plan's most controversial provisions is a work requirement for Medicaid recipients ages 19 to 64. Beginning in 2029, individuals would need to prove at least 80 hours per month of work, community service, or education, or risk losing their benefits. While exemptions exist for parents, pregnant women, and medically frail individuals, experts say the red tape could still ensnare those who qualify. Bureaucratic hurdles, like reporting hours or applying for exemptions, could trip up even those who comply. States would also face tough choices. Medicaid is the top federal funding source for state budgets, and slashing it would force cuts to optional benefits, lower provider payments, or even tax hikes. In some states, taxes might need to increase by up to 11% just to make up for lost funds. Food stamps aren't spared either. The proposal extends work requirements to older adults and parents of school-aged children, while limiting states' flexibility during economic downturns. For the first time, states would also need to shoulder part of the benefit costs, up to 25% in some cases. These changes could strip food aid from as many as 11 million people, including 4 million children. Grocery store owners are warning of ripple effects, too. SNAP benefits don't just help families. They fuel local economies, support nearly 400,000 jobs, and generate billions in wages and tax revenue. If these cuts move forward, the consequences could reshape communities across the nation.